Hello, my name is Crystal Nikki Christie, and I'm presenting to you about Operation Smile. 1 in every 700 children is born with a cleft lip or cleft palate. Cleft lips and cleft palates are openings in the lips, roofs of the mouth, or soft tissue in the back of the throat. It is unknown why cleft lips or cleft palates happen. It is congenital and develops during the embryonic stages. Cleft lips and cleft palates can lead to ear and sinus problems, dental deformities, impaired speech development, and eating and swallowing difficulty. Operation Smile is a charity organization that helps change the lives of children for the better by surgically repairing these deformities. Operation Smile is an international children's medical charity that performs safe, effective cleft lip, cleft palate, or other facial deformity surgeries, delivers post-op and ongoing medical therapies in low and middle income countries. They are pioneers in advocating the importance of safe surgery in resource-poor environments. They are the largest surgical charity of its kind. They help to find research about the causes of cleft lips and cleft palates, prevention of them, their treatment, and ways to eventually eradicate these deformities. The mission of Operation Smile is to mobilize a world of generous hearts to heal children's smiles and to transform lives around the globe. They are driven by compassion for children, and they produce life-changing results. There are some things that set Operation Smile apart from other charity organizations. They are distinguished by excellence. They go all around the world to the places that need the help the most and perform these surgeries, abiding by the global standards of care. This is so the patients and families receive the highest level of care, cleanliness, respect, and dignity that everyone deserves. Ways to help Operation Smile include donations and volunteering. It costs $240 to do one surgery. All donations add up and are appreciated by the charity. Fundraisers can be done to raise money by spreading the word and spreading smiles about the cause. Companies and their employees can help Operation Smile by matching gifts, payroll deductions, or an employee motivation program. Corporate giving includes developing business partnerships and donations of medical supplies and other goods in order to help the charity succeed in helping children in need. Volunteers can help by completing Smile service projects, educating the community on the cause, and raise money through fundraising to help children receive the free, life-changing surgeries from the Operation Smile medical volunteers. Nurses play an important role in Operation Smile medical volunteer team. They help to provide optimum care in a safe and secure surgical environment. The nursing specialties that are the most commonly needed for Operation Smile are operating room nurses, PACU nurses, and pre- and post-op nurses. Before the missions, nurses are responsible for their current BLS, PAL certifications, knowledge of the anatomy and physiology of a cleft lip and cleft palate, and current procedures to repair them. During the missions, they are responsible for setting the patient's rooms up, supply rooms, OR, PACU rooms, depending on the specialty that they're working in, and the care that the patients deserve during that time. After the missions, the nurses are responsible for cleaning and taking down the rooms and putting the equipment and supplies back in the trucks or where it came from. The nurse volunteers will need to have fundamental nursing, team building, and communication skills. Nursing skills are needed for the care of the pre-operative, perioperative, and post-operative patients. Medications will be given, vital signs will be taken, and other common nursing skills are needed for these missions. Team building and communication skills are needed to maintain good relationships and network with other medical staff, communicate with the clinical coordinators, and to share any important information while caring for their patients. Professional liability is always a concern when performing voluntary medical care. Some charities or organizations may have professional liability insurance that protect volunteers against liabilities. It's always a good idea to have personal liability insurance just in case. The Florida Good Samaritan Act states that those who are licensed to practice medicine while having clinical privileges at a nonprofit medical facility shall not be liable for any civil damages as a result of care or treatment provided graciously in such capacity as a result of any act or failure to act in such capacity in providing or arranging further medical treatment if such persons act as a reasonably prudent person licensed to practice medicine would have acted under the same or similar circumstances. No matter what, you should always function within the scope of your practice and licensure to be safe. The bottom line is the benefits of volunteering to you and to those served generally outweighs the threats of being sued. In closing, Operation Smile is a wonderful organization that changes the lives of many children and gives them a new and promising future, all with the start of a smile. You can help by going to operationsmile.org and donate money or volunteer your time to help provide a child with a smile. Every child deserves access to safe, quality surgical care. Each child deserves a future filled with hope. Operation Smile. Thank you for listening.